Hello and welcome to this video on a high-level overview of the Lookup Client submenu. When I click Lookup Client, I am presented with the search criteria screen. The best way to look up a client is using the member ID. The member ID is identical to the medical record number in Avatar. If I do not know the member ID, I can use any of the other search criteria, such as the Social Security number, last name, first name, and date of birth. No matter what criteria I have entered into the search criteria screen, I will only see clients who have been authorized to the logged-in agency, which in this case is test agency. Once I have entered in my criteria, I will click Search by Criteria. I will then be presented with a list of possible matches. Since I used the member ID, there is only one. However, I still want to verify the client name and date of birth to ensure I have the correct client listed. Once I'm sure I have the correct client, I will click on the Client ID hyperlink, which will bring me to the very first section of the Lookup client, which is the Provider Connect demographic. The demographic, as you see here, is also the very first tab listed in the menu along the left. Demographics allows you to update the client's ethnicity, address, phone number, education, employment, and so on. The Social Security number and date of birth, though, can only be updated in my avatar. The Financial Eligibility section allows you to view and edit information about the client's coverage and benefit information. Authorizations allows you to review and request authorizations in Provider Connect. You can also attach documentation to an authorization to provide additional reasoning for a request. Authorizations can only be approved, denied, or deleted in my avatar. Treatment. This section allows you to see previous treatment history. It allows you to enter new treatment and allows you to view how many units or number of services that are remaining on a client's authorization. Provider admission allows you to start an episode of care for a client and works just like the admission form in my avatar. Once a client is admitted, you will also be able to enter in a discharge date, which will work just like the discharge form in my avatar. The attachments provides a way for you to view and attach documents. You can attach documents such as PDF and image files. However, they must be less than 1 megabyte in size. Provider diagnosis. This allows you to view the client's diagnosis and allows coordinating providers to enter a diagnosis on the episode of care. I want to point out that all of these forms that I have just reviewed are core product forms for Provider Connect, and each one of these has additional documentation available in the help menu. The remaining items on this list have been custom developed for BHD, and these are not included in the help menu. So let's go ahead and take a look at the first one. The CARS Assessment Summary and below are all custom BHD forms that have been designed to meet the requirements of the county, state, and federal governments for public funding of behavioral health services. Let's go ahead and take a look at each one of these. The CARS Assessment Summary is completed in Avatar and available as a resource in Provider Connect. Gathering information in the comprehensive assessment is only the beginning of the recovery journey. Integration and summary of data and clinical formulation is an essential step in the process of developing a person-centered recovery plan. The assessment summary is about understanding the problem from the perspective of the individual and family, as well as understanding their needs, strengths, and resources. The assessment summary is the foundation for identifying barriers and developing goals and objectives. The CARS Client Change Update form is used to notify CARS of updates not editable in the client demographics, such as Social Security number or new insurance coverage. The client change form should be reviewed each time a PPS bundle is submitted. Next on our list is the CARS referral form. This is a read-only form that can be referenced for the PPS bundle submission. The form is completed in Avatar by the access points at the time of intake. The CARS SAR justification provides the rationalization for why a service is being authorized and allows the provider to explain his or her rationale for requesting funding based on the ASAM criteria. The notification of death is required by CARS. The data submitted in the form enables CARS to identify, respond to, monitor, and understand the deaths of clients that occur while enrolled in CARS services. The data helps CARS to develop quality improvement projects, identify important emerging trends, and improve the quality of life and health of the population. The PPS NOMS supplemental form is required by the county to provide a more comprehensive picture of consumer outcomes beyond state-required information. This form is required at intake, every 6 months during treatment, and at discharge. The State of Wisconsin PPS AOTA module form is required by the state and federal governments for clients receiving substance abuse services. The form needs to be completed at intake, every 6 months during treatment, and at discharge. The State of Wisconsin PPS General Information Form is required by the state and federal governments. The form captures expanded demographic information meant to help portray outcome data submitted to the state of Wisconsin. The form needs to be completed at the same time intervals as the other PPS forms. The State of Wisconsin PPS Mental Health Module is required by the state and federal governments for clients receiving mental health services. The form is completed at intake, every 6 months during treatment, and at discharge, just like the other PPS forms. The last one on our list is the waitlist contact attempts. This is used to record contact attempts when a client is on a waitlist for a specific program. And that concludes our overview of the Client Lookup section of Provider Connect.